Okay, so it's 11. We're going to go ahead and get started. Thanks everybody for joining today. I'm sorry we have to do it this way. We'll get into why. In order to get the most out of this meeting, pull out your ID cards if you have any question about what drug plan you already have. The answer is probably on the card in your wallet. There's very few of you now that we track the drug plans because we are non-compensated assistance for you on the prescription drug plans. So in order to answer some of your questions, you'll need to be able to say which plan you're on. So this is a great time to dig in your wallet if you're not really sure. Doesn't kill you, makes you so. That's hilarious. So anyway, Medicare annual open enrollment, it actually starts on the 15th. Today's the 1st. So today's the day we can first see the 2026 plans and what they look like and a little bit about what drugs they're covered. Nobody's enrolling in anything today. It might be the day that you look at it and go, hey, the plan I'm on, it still works for me. Great. Might be great news for you. You might not need to do anything. But from now and into the future, we don't really see a pathway where agents are going to be compensated. And we don't see a pathway because legally we cannot charge a fee to help and assist with a federal plan like this. So, yeah, it's a little interesting. I'm not kicking you guys all to the curb, though. I want to train you how to survive in the wild on your own. I'm here to be a backup, but I can't do it for you. I can't do 1,700 reviews and not get paid, right? And I can't pay my staff to do those reviews and not get paid. So I'm sorry in advance. This is where we are, and let's just move forward. All right. So a little update, Medicare will be changing a little bit next year. Every year they have an increase in the Part B cost. This year, you guys were paying 185, most of you. If you are higher income, you pay more than that. The base premium next year will be 206.50. And there was a deductible in your outpatient coverage this year. That's going up to 288. And the Part D for drugs, the only alphabet thing the government ever did that made sense, that deductible is going from 590 to 615. So Medicare supplements, your Plan F, G, high deductible, whatever the medical piece, that is tied to your birthday when you can change that. Okay, today we're talking about drug plans, or if you have Medicare Advantage plans, the drug plan built into that. The open enrollment for that is coming up now, 10/15 to 12/7. On 12/8, whatever you have or don't have is what you have or don't have for next year. So this is our window of time that we can shop, right? There is a deadline. Government's big on deadlines. So during the annual enrollment, you can change your prescription plan, or you could move to a Medicare Advantage plan. You could have an Advantage plan and move back to original Medicare and get a drug plan. But you may or may not have an open window to get a Medicare supplement. You can try, but you'd have to answer health questions, and it's not Obamacare. They can tell you no. So there are some special enrollment windows. There are people who are losing their Advantage plan. If that's you, Aetna and Santa Cruz County, they're out of here. So all of those people need to choose something different. That's on the Advantage plan, not Aetna drug plan, right? So make sure you hear all the words. So we are highly, highly, highly recommending that every single year for the rest of your life that you look at your current plan and the changes to that plan and evaluate if the new version of what you have, does it still exist? And if that's going to be the right plan for you. So that's what we're going to teach you how to do today. So prescription drug plans on a standalone basis are called Part D. Advantage plans often include a drug plan as well. So these are the things that we're talking about. This is why I can't charge a fee. They have to ensure that you're not being charged any sort of marketing consulting fees when you consider an enrollment for Part D. Brokers are not allowed to collect any fees from clients, period. End of subject. They made the law, not me. There's some drug plans that went away. Anthem, peace out, they're gone. They don't want to play in the drug plan world anymore. The Cigna Extra plan is gone, and you need to pick a new plan. Ironically enough, there's a new plan that's replacing it called Extra, which is going to confuse the heck out of everybody, but we'll talk about that. The WellCare Value Plus plan. Now, these companies, it's not enough to say Cigna, WellCare, Anthem. A lot of these companies had 3 plans. So sometimes only one of those plans is going away. In the case of Cigna, they're not even Cigna next year. It's called HealthSpring. So if you got a bunch of mail that said HealthSpring and you're like, I don't know these people, and you threw it away, bummer. Go fish it out of the blue can. Well, hopefully it didn't leave yet, right? Because your Cigna plan next year is called HealthSpring. Everybody sells it off to a different. It's the most incestuous place you've ever seen healthcare these days. So all Cigna plans are now marketed as HealthSpring, just a name change. There's some major rate shifts. If you had the Aetna Silver Script Choice Plan, this year it's $53.60. It's $103.60 next year. Hello, do you still want to pay that? We might want to look. So people like, do I need to do anything? I don't know. I'm going to teach you how to look, right? Because you're all individual. So we're going to teach you how to evaluate your coverage with things that are readily available online, how to put in your medications so that they're saved and you never have to do it again. And then optional, you can go in as a guest. However, if you go in as a guest, you're looking at that snapshot in that time. And when you exit out, everything is gone. So I highly recommend that you create an account in Medicare.gov so that that information is saved. There's a million other reasons when we get in there that you should have that account anyway. These are the last plans left standing in the state of California. So these are all the different names of the plan. So again, HealthSpring was Cigna. And so that one has a 0 premium. Yay, good on you. However, it has a $615 on all drug deductible, so the chances of it ever paying on 80% of you is pretty much 0. But if you have no drugs, or you have like one super cheap generic when you get in there and it's covered, no harm, no foul. I looked at this plan for my parents. They'll probably be keeping it. The next cheapest plan is down here, the value script at $570. So we're going to look at how to shop. So I'm going to demo how to go into Medicare.gov and how to do this for yourself. So let me exit the full screen. Here is Medicare.gov. I will try and make it a little bigger for you guys. This is the official website of the US government for Medicare. Make sure that you're seeing this little flag up here, official website. I want to show you guys one trick just because some of you are new to computer systems. If this doesn't change screens, somebody unmute and tell me. But if I start a new tab, if I go down here and type in Medicare.gov, I'm going to get all kinds of stuff, right? If I go up here and type in Medicare.gov, I go to Medicare.gov. So always use the address bar, not the Google search, if at all possible, or whatever, DuckDuckGo, whatever you're using, right? So you're going to go to your browser, whichever one you use, type in Medicare.gov, and you're going to end up here. So in this case, I'm already in this account for my mother, but let me just log out. See if it'll take me out. Okay, so when you guys go in, go up here to log in, right? Even if you don't have a username and password. If you already have an account, you're going to put in your information and hit continue here. If you don't, you're going to go here to create an account. All you're going to put in is your Medicare number, right? Pull out the red, white, and blue card, copy this part, and your Part A effective date goes here. And then you go to next. They're going to ask you your date of birth and a few other things, but you're verifying that you are you to the federal government. Create your own username and password. I guarantee you this is going to be the best use of your time because there's miraculous things you can do in here. So let me go back. I'm going to log in. So this person, see if that's saved. Ah, no, it didn't. Okay, so Edith Bunker, right? So Edith Bunker has her stuff in here. There's things Edith Bunker can do. So she'll get messages. She could click up here and see what that is. She could chat with Medicare. I don't know why. She can see her claims. So as Medicare gets your claims, they're all in here. If there's any sort of summary or notices, you can see them electronically. When you go to do your taxes at the end of the year, this place is your best friend. I lost my Medicare card. It got soaking wet because I went snorkeling with it in my wallet. I can get a new Medicare card. I can pay my Medicare premium. For those of you who are not taking Social Security retirement benefits, we have to pay a bill. You can go here and pay it. You can set up a person that can speak on your behalf. There is all kinds of things. And more importantly, for a lot of you, hey, you can see what plans you have. So in this case, my mom has Medicare A and B. She has the Cigna drug plan. She has an Anthem Blue Cross Medicare supplement. It's all right here. Oh, did I lose my prescription drug card? Boom, I can print a temporary. This place is your best friend. Create a username and password and use it. She can see it out of the $257 deductible this year, she's only used 97. So, she's doing okay. But if you're curious, it seems like I've paid a lot of little $10, $5, whatever bills, using Medicare. Where am I in my deductible? Boom, answer your own questions. You don't want to call these people, especially during open enrollment. So save yourself. So it's an awesome resource. You should do it regardless of this drug plan thing. But it is your go-to place to shop drug plans. So now I'm going to go up here to health and drug plans. And I want to find a plan. So this says, great, in 2025, here's the plan she's on. Kind of reviews what the premium was and what her deductible was. And then if I want to look at 2026 plans, I can do that, right? So it knows the drug she has, it knows the pharmacies she wanted to see. You can see if the pharmacies for that plan are in-network preferred or just in-network. You can edit pharmacies, and here's some drugs that she had. So if you're not on some of these drugs anymore, or you have new ones, add them or edit and delete them. But at least once you have it saved in here, it gives you a base to use. So the open enrollment is considered coming up soon, but we can go ahead and say find plans. Make sure you're on 2026. It's going to default as of today to that. And you have your zip code, and then go ahead and continue. You want to see Medicare drug plans, right? Unless you are on alignment or, a Medicare Advantage plan, Kaiser, then you would look at Advantage plans. So we're doing drug plans, find drug plans. Again, so it's saying this plan is coming up best. So what you want to look at is a number of things. Monthly premium, that's one piece of the pie. How much do my drugs cost for the year? That's another piece of the pie. What's my total cost? So this one is the same plan that she had, Cigna, but now it's called HealthSpring. So she'll be keeping her same plan. That's the one that came up best, right? You want to make sure you're sorting by lowest drug plus premium. So you can sort by just the deductible. You could sort by the lowest premium. This plan would always come up to the top because it's a zero. But really, you want to know my monthly premium for my plan plus my monthly cost for my drugs for the year. What's the cheapest? So make sure it's defaulted to lowest drug and premium cost. So here's her plan is going to cost nothing. It's a zero premium. Her total cost for the year is $199 if she goes to a retail pharmacy, 63 if she uses the mail order. And you can click on view drugs and their costs. And now you can see because she usually gets, 30 days or 90 days supply, takes it once a day. Some she gets every 2 months. You can kind of frequent this and change as much as you want. You can look at the different pharmacies. You can see that the costs at the different pharmacies are different. Mail order, it's going to charge you $10 for this when CVS would charge you 79. Girlfriend, I'm doing mail order, right? Plus it's more convenient. So you can look at all of this side by side. It's awesome. There's some things that it's not awesome about, and we will get to that later. But it tells you next year the cap, as long as your drug is covered by the plan that you are on, then you'll never pay more than $2,100 for your drugs. So if you're on a $30,000 chemo drug and it's covered by your plan, on month one, you're going to pay $2,100 and it's no cost to you for the rest of the year. It does cost the insurance company that you pick, which is why we're down to 10 drug plans this year because nobody really wants to play in this world. So, you can look at star ratings, which honestly means nothing. It's coming soon because they just changed names, right? It's a whole new plan. I don't put much credence in the star ratings. Everybody hates insurance. If you get anything 3 and above, they did something right. So that's kind of just a real easy one. I want to go into a what if world now. So I'm going to go back to Medicare.gov. I want to log out. Fine, log me out. All right. So I'm not going to log in this time. I'm just going to go to the health and drug plans because I'm not going to be any specific person. I want to look at drug plans. You can check all this stuff about how does it work, all of that sort of things. You can learn the basics, how to use your plan. There's a number of really good pieces of information here. So all the plans have to cover at least 2 drugs in every therapeutic class. So there has to be 2 short-acting insulins, 2 long-acting, 2 whatever. But some plans have more than others. Some drugs, let me look here. Find and compare health drugs. Hot topic items. Let's hit something polarizing like Ozempic. So I want to make sure I'm looking at 2026. I'll put in the local zip code. I want to look at drug plans. Same thing that we did on the other one. If you have Medi-Cal, if you have supplemental Social Security, if you have any extra help, make sure you click these buttons because then it will reflect that you have lower copays and it will advise you to do the plan that has the lower copays available to you. In this case, I don't. So I'll say I don't get any help. Yes, I want to see the drug plans or the drug costs. That's the whole point of doing this. If it was just on premium, I'd pick the cheapest plan. Duh. So let's click something like Ozempic. I want to lose some weight. Add the drug. Okay. So there's different ones. Do you take the 2 milligram, the 4 milligram, the 6, right? Make sure you pick what's on the bottle. So I'll default to this one. I get 1 pen a month. So I'll add that to my list. And maybe I'll do something nice and cheap like atorvastatin. I got a little high cholesterol. I'll add that. Sure, 40 milligrams. If it's not, pick one of the other ones. I take one a day. So let's just say that's it. Done adding my drugs. So now you can say, I'm in 95062, and I want to find pharmacies. I'll look at mail order. Sometimes that's cheaper. Are these, what pharmacy do you like to use? And pick a couple of others just for the sake of seeing it. So we'll pick Walgreens, Safeway. I'm sure there's a CVS. Sure, we'll pick these. We'll continue. And now it's saying, oh, this plan, when I look at lowest drug plus premium cost, always check this default, comes up the best. But plan details. So here's the monthly premium. Here's drug costs. This cannot be right. So it's saying, sure, it's covered. Here's what it costs, $712, right? Or it's telling you that's the cost. It doesn't tell you that that's not on the formulary. So here you can look at it month by month. Here's what it would cost the first month and then this one. What it doesn't tell you is Ozempic is prior authorization. All your weight loss drugs, a lot of your cardiac drugs, a lot of your barbiturates, pain medications are prior authorization. Your doctor has to go to bat for you and say, you meet a specific set of requirements to get this. And for Ozempic and the weight loss drugs, it's that you have to have a diagnosis of diabetes, morbid obesity, not just obese, like my clothes don't fit, like morbid obesity. So do know that there's some things that even this government resource really isn't good at telling you. The things I was using before when I was helping you, tell me if it's prior authorization. So let's say, okay, this is what I want to look at. I would always recommend now that you look at this and you go and to the actual website, to the actual company to do the application. Because when you put in your drugs there, it's going to tell you if it's prior authorization. It's going to tell you if you can only get a certain number of these meds per month. It's going to tell you if you have to try other medications before that one can get approved. So there are things that you need to know that sadly are not really available in this, but it's a really good place to start. So let me go back to little presentation here. So this is your step-by-step guide. Don't try and take notes. Cheat. I do. Pull out your cell phone. Take a picture of that screen. It's right there for you because then you have step-by-step. Go to the website, Medicare.gov. Create your account link. Once you have that, you put in your medications, right? It's all step-by-step for you. So make sure that you just take a picture of that. I'll leave that on the screen. So we have a manageable size group. Let me look at the chat. I do not see any questions in the chat. I cannot, you guys are all like about this big when I see you. So if you have a question, try and unmute yourself. It's the little microphone that's probably red with a slash through it. If you click on it, the red goes away and you can ask a question. You don't know something is missing on the site, Michelle. That's the problem. And no, you cannot pay me. It's illegal. And well, where's the flag that shows it's legitimate? Has everybody taken their picture of this?
Yeah.
Okay, good. I can come back to it in the end.
Pamela, I have a question.
Okay, hang on a sec, because I can barely hear whoever that is. Let me turn up my volume. Okay, try that again.
Okay, Pamela, this is Brendan Torrin speaking on behalf of Sonia Torrin.
Uh-huh.
Any rate, Mike, I have kind of a two-pronged question: how to actually change the plan and how to make payments through Social Security.
Okay. So on October 15th, when you come back into there, then there will be an apply button next to whatever plan that you want. It's not there now because open enrollment starts in a couple of weeks, right? Now is our shopping time. Now is our find out from our doctor if we have to change drugs or that sort of thing. But if you come back on October 15th, you'll see an apply now next to each of those plans. So when you identify the best plan, you hit apply now. The applications are basically name, address, date of birth, copy the information off your Medicare card. It's the annual open enrollment, so you don't have to worry about picking a special enrollment window. That's a little weird and different. It'll just say, if you're applying between October 15th and December 7th, skip this section. We know you're coming. And then there'll be a payment option. The payment option, if you want it coming out of Social Security, press that. If the payment option is something different, press that. And then you hit submit. I do not, on any level, ever recommend paper applications by mail or fax. They will tell you it's available. It will go in the recycle bin 9 times out of 10. There was a whole lot of people who insisted on doing a paper application, like, here you go, you can mail it, you can fax it. They had fax confirmations. Companies swore they never got it. So there's only 10 companies left. Geez, people, be nice to them, man. Use their systems, right? I'm sorry that we have to learn something new. Trust me, I am not enjoying this. This is an hour of uncompensated time here to help. So, but do it online. Then you have a confirmation number. You can follow up on a confirmation number. So you'll be telling them how you want to do it. Right now, you can only look. You can't actually buy. On the 15th, you can start to buy. If the plan, let's say in the case of Edith Bunker, the plan that she's on is still the best plan for her. She doesn't have to do a thing. She'd be happy if she was doing this, right? But she knows what it is. She'll get a new ID card probably in December for the next year. Oh, and a good note, throw away your old cards. On January 1st, new card goes in the wallet, old card comes out. Don't save it. It's no good. There's no reason to save it. New card in wallet, out with the old, right? Should be part of your New Year's tradition.
So basically, then once you hit the apply button and submit stuff,
Mhm.
then are they then going to contact you and we kind of go through all the same kind of stuff, I guess, that you
No,
used to go with through
no,
with us with them?
no, that's you doing it in this shopping part.
Okay. So,
Yeah.
but so basically, once you do the shopping part and say, I agree to this plan, that's it then? Then you start, then you,
You're not agreeing to the plan. If you're keeping the plan you're on, you
okay.
need to do nothing.
Right, right.
If you are applying for a new plan,
Yes.
and you submit the application, usually about 10 days later, you'll get like a welcome letter and then your card and maybe a booklet about the plan. That's how you know you got accepted. On
Okay.
December 7th, if you don't have those things, you better be on the phone, calling them, hey, I applied for your plan. I haven't received this stuff, right? And don't wait till the 7th. You can't even imagine what a nightmare the phone lines are that day, right? So
Mhm.
if you're applying in October and you don't see something by November, call them, right?
Okay.
And
It's
so,
really just that easy then?
well, yeah, it was
Okay.
a lot easier when I was doing everything for you.
Absolutely.
It's
Absolutely.
not rocket science. That's what I'm trying to get you guys to understand. Now, some of you have some pretty weird drugs.
Mhm.
I would say 50% of my clients have no drugs, or they're on like what we call the senior cocktail, a torvastatin for your cholesterol, a little lisinopril for your, blood pressure, maybe a water pill. And so those two cheapest plans, they're going to work for you, right? But a lot of people last year, I did the reviews. I told you call Cigna and apply for this plan, or I sent you the link and people didn't do it, or they didn't finish, or they did it and they didn't pay their bill. So if you have an active plan and you like it and you want it to renew, no action is required. If you're on a plan that went away, you got to replace it with something. If you are on a plan that's no longer good for you, it's in your benefit to replace it with something that's better. Okay.
Now, the thing about like prior authorization for drugs, the
Mhm.
plan that we're on obviously has already got that in place. Now, how will we know whether or not the new plan will need, I mean, and how does one get the authorization for that then?
So if you went back to Medicare.gov and it told you, okay, whatever plan it was, go to that website. Let's say it's Cigna. It'll link you over to it. I want this plan. It takes you to Cigna's website.
Okay.
You apply there. Look at the information. So there is, I'm going to go ahead and put this back. I think I've got a little. So anyway, it's putting a, oh, and remember, garbage in, garbage out. If I told them, here's a classic one, uh, thyroid medication. Half the women I know are on it. If you say I have to have the brand name, it's going to give you the brand name prices. If you really take the generic, put in the name on the bottle. I know you can't spell it. It's okay. All you have to do is type in the first few letters and it comes up, right? Pick the right dosage. And it's really critical. Is it a tablet or is it a capsule? Because if you put in capsule, that sucker is horrendously expensive. If you put in tablet, it's like pennies, right? Garbage in, garbage out. That's how computers work. They don't know. They're taking your word for it that you put in the right info. So pull out all your little bottles, pull your stuff out of the fridge, wherever it is you bury that stuff, and type in the first few letters. And then look at the, is it a tablet or a capsule? It's 5 milligrams. Click on it, right? And add that to your list. So just remember the garbage in, garbage out. Um, you can pick the different pharmacies. You can look at that. Um, so you're again looking for lowest annual cost when you look at premiums and the cost of the medications. So it's not one or the other, it's that combination. This is the initials you'll see by things. PA, prior authorization. Your doctor's going to have to go to bat is, why somebody needs something. Oftentimes that's all that's required. If you go to the pharmacy in January to pick up that medication, they may fill it for a 130-day supply, but in order to keep getting that drug, you have to have the prior authorization figured out. Your doctors know that this happens. Your doctors that prescribe these kind of drugs frequently know that this happens. This is not new. This has always been there. Some of you may have come up. Quantity limits is something that most people don't run up against, but common sense would tell you only a certain amount of this drug is normal. If you, for whatever reason, need a higher amount than what that is, and there's not as many drugs on this list, then your doctor would have to go to bat. No, they have to take this lower dose more times a day. That's why they need more, whatever it is.
So we just basically contact the doctor's office, then tell them that, hey, this new prescription company needs an authorization, and they would go ahead and then do that for us.
It's better to do that than to get to the pharmacy and wait in line and then be told this. So if
Right,
you
right, because
know
then you
it in
might run out.
advance, right? So if you've ran some examples, you find your plan, you know, before the open enrollment is not going to start for you to actually apply until the 15th. And the new plan of whatever you do will be effective on the 1st. If you automatically renew, get a new card, again, make sure you throw away the old one. If you weren't on anything because you didn't pay your bill or because your plan went away, Anthem or one of the ones that's leaving, then you got this notice, and there you got letters from your insurance carriers that you should have in your hot little hands by now. One of two things: a letter that said bye bye, go do something else, or one that says, here's what your plan looked like in 2025, side by side with here's what your plan looks like in 2026.
Mhm.
If you are accepting of that and it's the best plan for you, no action required, right?
All right.
So if you are feeling priced out now, these drug plans are costing about what a lot of the Medicare supplements were costing. The cost of Medicare is going up and the cost of your supplements went up double digits this year. We anticipate it will be the same next year as well.
Wow.
So there's no stopping this trend that we're seeing. So if you're feeling priced out, maybe it's time to look at a Medicare Advantage plan. Um, some of those have gone away as well. In Santa Cruz County, which just by eyeballing, most of you are in Santa Cruz County, there's really only Medicare Advantage plans that work with the Sutter Health doctors. The plans that worked with Dignity are all gone for next year. So if you have doctors in the Sutter Health system, if you're feeling this real pinch because of all these different rate increases, you're welcome to make an appointment and we can talk about your Medicare supplement. If that's too invasive for you, we have, what is our Medicare Advantage Curious Zoom is going to be on the 6th. So those plans are like $59 and $79 that include your drug plan with no deductibles, by the way. So it might be something to consider. If that's like, no, I'm never doing one, fine, great. I'm not trying to force you into doing it. I'm just saying that they exist. And for some people who are having a very difficult time getting a doctor or your doctor went away, they might be the ticket to get that done. So it's an option. I open up those we still do get paid on. So I'm happy to give you a consultation on that. Um, but the next one where we're just going to talk about Medicare Advantage plans in general is on the 6th. So next Monday. Any other questions? You guys are welcome to unmute and ask.
Yeah, this is Mary Ann.
Mhm.
First of all, my daughter would probably be helped by this, but she's sitting in the dental surgeon's office this
We're
morning.
doing this like 10 times and we'll be posting the recording on the website, my website, lowcostcahealth.com.
Oh, okay. Okay. So we go to that and we can see when you're gonna do the recording again.
Well, or you can watch this recording.
Watch
So
it
in case
again.
it'll be posted there, so you can
Oh,
just listen
okay.
to it. So there's
Okay.
some people that work and really can't make these Zooms. So we're trying to, our website is gonna be the home base. You can't find something, go look there first.
Okay. And I have another question. I belong to the Carmel Foundation and I see in their newsletter sometimes they have these events where you can make an appointment and they have somebody that will sit down with you and
High
will help.
cap in each county. So if you Google high cap,
Okay.
HICAP,
Okay.
in Santa Cruz, Monterey, wherever, whatever, every county has one. They have volunteers who can help walk people through this stuff.
So you'd go and you'd have your drug list and they'd basically do
I
what,
don't know how they do it. Oftentimes it's a big community event and they just talk about things, but they don't actually do it. Other places you might get them to do it. I can't control how they work. It's
oh,
a
I know, but
volunteer
it's
organism.
probably the same thing. So if I learn how to do what you just showed us, which looks complicated, but I
It's
think I,
not that bad.
yeah, I
You
know.
guys' fear of doing it, I promise, is way worse than actually
Well,
doing it.
thank you for this because now it will seem more familiar. It won't seem so
Hmm.
foreign. Thanks a
It's
lot.
daunting because you've never had to do it.
Right.
For 20 years, actually, when I became an agent, Medicare drug plans didn't exist. We didn't get these till 2006, and I got my license in 2002. So I didn't have to do this the first few years. And, there weren't very many drug plans in the beginning, and most of you guys didn't take that many drugs. But now that they're covered by insurance, you take more drugs. Might want to think about that one. So, you know, it's just the way it is. But
I have a question.
sure.
How do I know if my supplement plan is still the best plan for me? Are you going to go over that? And
So
thank
your
you.
Medicare supplement is tied to your birthday. So if your birthday is August, September, October, ask me now. You can make an appointment for that. So we'll talk individually. But whenever your appointment or your birthday comes up, birthday supplement, call Pam, right?
Okay.
Just
So
remember those.
so my birthday's in the month of December, so I need to call you in December or November.
In early December, well, ideally the 9th, make your appointment for the 9th or later because the last week of open enrollment is hell.
Okay.
Right. But the earliest you could make a change, let's say we identify something that, hey, you can get the same plan you have at another company for less money. Cool. But you can only do it that month or the next month for the following month. So in December would be a good time to do it and start January 1st with everything else.
Thank you very much. And
I have a December birthday too, so it makes our life easy.
Thank you so much. And from the bottom of my heart, I can't thank you enough for doing all of these numerous Zooms. It's just a huge undertaking, and I'm so grateful.
Well,
I'm so grateful that you're
I'm
my
grateful that
agent.
you guys showed up because my staff honestly is just getting belittled. Michael takes the worst of it because he answers the phone. So God, be nice to him, will you? It's not his fault the government did this to us. So it's not our fault, it's not your fault. You know, whenever we vote, it has unintended consequences. And your Medicare is sadly governed by people who never are on Medicare because all the government employees don't have this. So they have no idea of which we speak or what we have to deal with, but yet they make the rules. And when they punish an insurance company, they're going to punish the agents who have to punish you. You know, the whole thing about how stuff runs downhill. So I'm sorry it came to this, but I can't throw y'all to the wolves.
This is Virginia. I 100% agree with Rebecca. Thank you so much for.
Yeah, thanks.
This is
And
all.
the people who actually show up on these, like you guys get it. It's the ones who you don't see here that didn't. But if you have some really weird complication thing and you can't get answers, let's say you ID that, you know, whatever, XYZ plan is the best for you. And you have like really complicated drug situations, I would call and work with that carrier, say, you know, it looks like this is the best plan, but you know, are there any prior authorizations or things that I need to know? You can do this all online, but if you still are concerned about it, call that carrier, right? And they should be able to answer that. But just remember, all these carriers probably a couple of months ago had, you know, this many employees. And now to handle open enrollment, they have this many employees. Somebody might have just been hired yesterday. And some people, you'll hear it like they know their stuff, right? So if the person doesn't know their stuff, ask for somebody else or hang up and dial again. You'll get a different person. You guys.
Pam, I have a question.
Mhm.
If we were both on Blue Shield's supplement last year or currently, can now I switch to a Advantage plan and she
Yes.
can stay on Blue Shield if she
No.
wants?
So with Advantage plans are a complete total replacement of Medicare. So it's privatizing your Medicare. So if you sign up for an Advantage plan, you have to cancel your supplement. Now everything comes from the Advantage plan. So you no longer have Medicare from the government, you have Medicare through whatever Advantage plan that you signed up for.
So if we were both on Blue Shield supplement, we'd both have to cancel then at the same time, and
not at the same time. I mean, if you go to alignment, I presume, and Janet doesn't, then you cancel yours, she doesn't cancel hers, right?
Oh, okay.
I mean,
Okay,
you're
yeah.
two separate individuals. You could each do something different. It
Okay.
is not uncommon at all in couples that one person is like, I am never going to go unless you hit me with the bus. And another person is a high-end user. So you can pick and choose what works best for each of you. Advantage plans have their place. They're certainly more cost effective, but they are more restrictive. Are all of your doctors, every blessed one of them, part of Sutter Santa Cruz? If the answer is yes, Advantage plans could be great. If they're not, you got a doctor over here at Dignity and somebody else over the hill, probably not going to be a good fit.
And my birthday was in August, so I can still change.
You're
as
still
well.
in the window. You have 60 days from your birthday if you wanted to affect a change. Blue Shield, still pretty competitive. We had Humana had a real discount version of their plan that didn't include any gym memberships or any bells or whistles. And it was super cost effective. They have realized the errors of their ways, and after the 19th, it will never be sold again. So you can switch to it now, but it will close the window on new people coming to that plan on the 19th. So you can call and make an appointment to discuss it.
Pam,
Uh-huh.
you said that Medicare Advantage doesn't cover dignity. Was that what?
There are no Medicare Advantage plans next year that include Dignity Health.
So what does that mean if you need to go to an emergency room in Santa Cruz County? We only have.
Well, at the hospital, yes, but not doctors. So it's not Dominican Hospital, that's covered. It's our own Dominican Hospital and Watsonville are only emergency rooms. Both of those are in there because Sutter doesn't have an emergency room here in Santa Cruz.
Right.
But if you had, let's say, a dermatologist at Dignity, that would not be in your network.
Okay.
So,
Pam,
uh-huh.
Since I realize people don't raise their hand anyway,
Oh,
I wanted
I
to.
can't always see it because you guys have little specks.
Your little specks. It's just so unbelievably impressive how much you know. My goodness, your
Well,
brain.
20 some odd years of being here, you
when
accumulate
go,
some stuff.
please dedicate your brain to science so they can study and see why.
I'm going to try and keep my brain as long as I can. Whatever you guys want to do with it when I'm done, go ahead, knock yourself out.
But I do want to remind all of us that how food matters, our exercise, our gratitude, thought, these things matter for our health. I just wanted to add that. Yeah.
The Queen of Organics has spoken. Yes. So
it does matter.
It does matter.
Yeah.
Thankfully, with my offices on your block, it makes life easy.
Oh, you are so getting noodle bowls.
All right. Any other questions?
Yes. Hi, this is Lauren calling. I
Okay.
have a question for you.
Sure.
So I just as an example, I have Humana this year and I have a prescription.
Which Humana?
Achieve. Humana Achieve.
Achieve. They have basic, value, and Premier. So I'm not sure about Humana Achieve.
Well, but that doesn't matter because the same issue as whether last year I had Cigna. There's something that just confuses me. So I get a prescription from my doctor and I say, okay, I use Costco. And they send the prescription into Costco, and then I check the price at Costco versus, say, CVS, Safeway, whatever.
Good for you.
And and I also use GoodRx, and so sometimes it comes in that at CVS it's $20, and at Costco it's $58, and at Walgreens it's $12, and
it is just like groceries.
Okay, so but if I go, well, I'm going to go to CVS because it's half the price, I have to then get a new paper prescription from my doctor. To just switch. So if I want to
do doctors still write paper prescriptions? I've never had one in a really long time. I mean, most of the time they're electronically calling it in or sending it over to the, so all you have to do is go back to your doctor and say, hey, it was too expensive at Costco. Can you send that over to CVS, whatever it was?
Yeah, that will work. I was just saying that because that it becomes a hassle because my doctor does not respond immediately, and so then
Shocking.
there's a lot of back and forth thing. But that's just the way it goes, right?
Yeah. I
That,
have
that
to tell you that I did learn a couple of words this summer.
okay.
Shocking and preferment. Preferment instead of retirement. I'm only going to do the stuff I want to do. Love it.
Yeah.
Shocking. It works whether it was good, bad, indifferent. Your doctor didn't respond. Shocking. They responded. Wow, shocking, right?
Yeah.
Same word, works for both.
Okay. Okay.
So you
All
can,
right. So
you
it's
can
just
take
the way
that
it
from this.
goes. They
Yeah.
all are doing different prices, which I don't understand.
I feel for especially the primary care doctors, if there was a more underappreciated job,
Yeah.
other than maybe for sanitary workers, there isn't one. They have to speak to 40 people a day. They
Mhm.
have to get all these people to their referrals, to get your prescriptions, to get this, to get that, to do that. They have to, there's people in the office, people coughing on them, puking on them, whatever. It's a bad job. And
Yeah.
on the doctor pay scale, they get the lowest and probably work the hardest.
Yeah.
So that is in large part, and the cost of living here, why we can't keep them. And we have a definite primary care doctor shortage here. You can have the best insurance in the world. Doesn't mean you're going to get an appointment,
Yeah.
right? So your insurance is a method of payment. Doctor is the actual health care. And sadly, the twain shall not meet. There are no doctors in Santa Cruz County, in Sutter or Dignity, accepting new patients with Medicare. Think about that for all the people who have had Kaiser and now they want to go, oh, I want to get a doctor at Sutter or Dignity. I'll get out of Kaiser. They can go to the new community clinic. It's the only place accepting new patients. So another, just aside from the drug plan, go see your doctor, even if you're super healthy, once every 3 years. Do not get caught in what I got caught with my parents who are 88 and 90, and they were super healthy up to a year ago. Like dad, he was using the VA. Now it's a real bugger to get him over there. And my mom was the medical ghost who has no records of being seen in 10 years. So she thought she had a doctor, but that doctor had kicked her to the curb. So when they started having all these problems, they're like, take them back to their primary. Took me over 6 months to get one. So go throw money at them once every 3 years, whether you need to or not, just so they don't kick you out.
Right. Well, I also want to thank you, as everybody else has, for the work you're doing on our behalf.
I appreciate that. Thank you.
Yeah.
And I'm sorry, honestly, it would have been easier to just sometimes do all the reviews. But I mean, I'm not going to be here forever. I turned 66 this year. I already got my Medicare. So, someday I'll be gone and Journey and them can handle you. So for now, I like what I do. So don't make me not like it. I'll be here. All right. Any other questions? We've got like 7 more minutes left. If not, I'll give you back the time in your day. So if you're investigating Medicare Advantage, if it's your birthday, you're within 60 days of it, and you want a Medicare supplement review, feel free to call and make an appointment for those things. I just can't do the individual drug reviews. If you load all of your stuff into Medicare.gov and you want a super quick, you will give me the username and password and and I can see what plan you picked or tell me what one you picked. I can look at another system. I can do that, but I'm not enrolling anybody or pressing any buttons. The other problem I have is the errors and omission, the professional liability insurance we have to carry does not cover us for any uncompensated work. So if I said something offensive today, I'm not covered. If I help you with a plan that's not compensated, I'm not covered. So it adds to the reasons why we have to make a change in what we do. There is one plan that is paying a commission. And do know that of that, I get $1.40 or something a month for a year. So it's not that exciting. But if you end up on the new Aetna Extra plan, I could push a button for that one. But for the rest of them, yeah, we're all kicked to the curb.
Pamela, I have a question.
Uh-huh.
I heard you say that local doctors after, I don't know when you said like in a month, are no longer accepting patients
New
covered by
patients.
Medicare.
Mhm.
Did I hear that? And then, so does that also apply to Medicare Advantage? They're not accepting Medicare Advantage?
There's, with like the Sutter plan, they gave us a list of 5 doctors, 1 in each clinic that will accept new patients,
On which? On Medicare or Medicare Advantage?
Medicare Advantage.
But they're not accepting Medicare patients.
They're not accepting new patients with traditional Medicare.
Wow.
They haven't been,
Right.
Sutter hasn't been for 5 years. It's been a couple years now at Dignity. We had a new UCSF clinic that I was sending everybody to. Go sign up now, get in with them. And now I got word back that they stopped taking new Medicare patients, probably because everybody in there has gray hair, because I sent them over there. But yeah, Medicare, if you go in and you get seen by a doctor and you pay cash, they get this much money. I think you guys can see me. If you go in with traditional, say your work insurance or Covered California, they get a lesser amount of money. If you go in with Medicare, you've seen the bills, right? Your doctor charged 500, they got 125, right? This is why they don't want to accept a tremendous amount of people with Medicare. And let's face it, none of us are getting any younger, so their patient population gets older on them.
I have another question.
Mhm.
I'm in the Medicare thing and I'm looking at Cigna Healthcare HealthSpring Assurance,
Uh-huh.
PPP. They say the overview is there's 0 monthly premium. How does
It
that
is
work?
0 monthly premium.
Yeah,
They don't charge you anything,
that's for real?
for real.
Whoa.
But it also doesn't pay anything until you've paid $615 worth of drugs.
Okay. Yeah.
So for the like in my mom's example that I showed you guys, right?
Yeah.
It worked for her, right? In my example, I don't take any drugs, any point in a storm. So if you guys have late enrollment penalties, I have clients who didn't get a drug plan, or they got it canceled because they didn't pay their premiums, and then they've had a gap somewhere. So depending on how long that gap was, there's a penalty that gets put on you. So that 0 premium for them, they may still get a bill from HealthSpring saying the government told us you had this penalty, we have to collect it. If they don't pay it, they'll still get canceled even on a 0 premium. So I have a couple notable cases that I can almost count on them getting canceled every year because they won't pay what they're supposed to pay.
Mm.
If you make more money, yeah, you get punished for that too. The government's really big on, you make money, I want it from you. So you make more than 109,000 next year, in 2020, next year they'll look at 2024 taxes, what hopefully we've already done. If your adjusted gross income as a single person is under 109, you pay the standard amount. But if it's over that, you pay more. And they ding you on the drug plan too. So my free drug plan ends up costing me about $70 a month. So do know that that happens, but the government collects that. So most of you don't notice because you're on Social Security.
I have a
But
question.
you notice when they send a bill. Yeah.
On the Advantage, you
Mhm.
say Sutter doctors are only included in Santa Cruz County. Does Sutter doctors include Palo Alto Medical Foundation doctors?
That is, yeah.
Okay, they're the
So
same thing.
Santa Cruz Medical became Palo Alto Medical, who got bought by Sutter.
Okay.
Yeah.
And when you say only Sutter doctors in Santa Cruz County, no Sutter doctors in another county are covered?
Only if they refer you, because there's things we can't do here. And
Okay.
we don't have a burn unit. They're going to send you to a burn unit and it gets covered. If we
Okay.
do open brain surgery, you're probably going to get sent up to the Sutter in San Francisco. But it's only
Okay.
because they did it, not because you chose it. You can't
Okay.
just randomly go pick a Sutter doctor in Los Gatos or someplace.
Yeah. Okay, thank you.
Yeah. So again, the Medicare Advantage Curious, that's the next Zoom I'm doing on the 6th. So if you want the no pressure version. If you want the individual version, call and make an appointment. We can talk about that. But again, in Santa Cruz County, our choices are pretty limited. For the people who are in Santa Clara, they got a ton of options. You know, the more urban the area, the more competition of doctors, the more options there will be. We've got 2 groups and nobody wants to take new patients, so not a lot of competition around here. Okay, any last questions? Otherwise, I'm gonna stop sharing, cancel or stop my recording. And I will see you guys on the next Zoom or when you call. And we'll be doing another one of these on the 14th. So if you want to hear it all again, glutton for punishments that you might be, then the 14th will
Thanks
be the next
again, and
one.
thanks for the
Thank
sense of
you.
humor.
You have to.
Yeah.
Otherwise, I would have quit a long time ago.
Right. Bye.
All right. See you guys later.
Thank you.
Bye.